There were approximately 36.7 million people worldwide living with HIV or AIDS at the end of 2015. Of these, 1.8 million were children. An estimated 2.1 million individuals worldwide became newly infected with HIV in 2015. This includes 15,000 children. Most of these children live in sub-Saharan Africa and were infected by HIV-positive mothers during pregnancy, childbirth, or breastfeeding. Currently, only 60% of people with HIV know their status. The remaining 40%, or over 14 million people, still need to access HIV testing services. What is HIV?
HIV or human immunodeficiency virus is the type of virus which attacks our CD4 cells or T cells. HIV, when it gets inside our body, will reduce these T cells, which leads to higher chance of pathogen infection. There is no effective cure for HIV yet. However, there is a cure that can control HIV from spreading throughout the body. HIV can be found by testing, and it's the only way to know the condition.
What is T cell? T cell or T lymphocyte is a type of white blood cell that is a part of immune system and developed from stem cells in the bone marrow. It helps protect the body from pathogen infection and help fight cancer. How can HIV infect our body? HIV can transfer from person to person through fluids such as blood, breast milk, semen, and vaginal fluid. How immune system respond to HIV?
HIV enters to our body from mucous membrane through bloodstream. Then HIV will bind to the receptor of CD4 cells. HIV envelope and CD4 membrane will fuse and allow HIV to enter the CD4 cells. HIV uses enzyme to change its RNA to be DNA so it can fuse with the DNA of host cells. After host cells get infected by HIV, some of host cells will go into apoptosis state to destroy the HIV in the same time. If host cell does not get destroyed and can survive, host cell will replicate as well as virus. This causes the virus to spread rapidly throughout the body. At this point, HIV can be prevented before developing to AIDS by using medicine called antiretroviral, which will interrupt the replication of infected cells.
How can HIV damage the cell? When HIV infected into the body, it will go through the immune system, specifically to T cell. The virus will insert itself into the cell's gene. Then, when the cell replicates, the virus will be automatically multiplied. The duplication of virus will spread the virus widely in the system, which makes the immune system weaker. The infection weakens the immune system and prevent the immune response to respond to other bacteria, virus, or disease. Symptoms of HIV.
Symptoms of HIV is mild flu-like symptoms such as fever, headache, and lack of energy. More symptoms are skin rash and skin sore. Then these symptoms will disappear and will get more severe after many years.
The difference between HIV and AIDS.
HIV is the virus, but AIDS is the disease caused by HIV virus. AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is the last stage of infected HIV. During this stage, patients will have number of CD4 cells or T cells lower than 200 cells per cubic milliliters, while normal people have about 500 to 1,600 cells.
Patients can easily get sick and hard to cure, so they need to take the medicine forever. Patients cannot live without medicine when they are in this stage. They will die from other disease, not AIDS, because their body cannot fight with any pathogen. Patient usually dies from cancer or flu. How can HIV develop to AIDS?
After AIDS, to 10 years of infection of HIV without ART, as T cells have been destroyed for a long time, patient immune system would be weakened to the point that our body cannot protect ourselves from pathogen and that eventually will progress to AIDS.